Professor Yousefi, who's the co-founder and president and CEO of MeshAI. So he is an academic entrepreneur and global algorithm expert with more than 130 publications and patents. He's held positions at the University of Toronto, Canada, Ecole, Polytechnique, I'm not going to be able to pronounce that next part, so you'll have to tell me, in Switzerland, Jilin University in China, as well as the University of California, Santa Cruz, and Queen's University of Canada, where he's currently a full professor. He's co-founded 3 healthcare startups since 2014 and is currently the CEO of Mesh Scheduling Incorporated, aka MeshAI. So take it away.
Thank you so much. Yeah, EPFL in Lausanne, Switzerland. First of all, thank you, Yuli, Ruchi, InnovatorMD team to having invited me here. It's truly an honor and privilege to be among you. I'm not a medical doctor, but I've essentially dedicated my life to make life better for them. So I'll tell you about my journey a little bit today. So I'll talk to you about MeshAI today. So I'm going to start a little bit negative. I'm a very optimistic individual, but I always joke about it. Given what happened to me about 14 years ago, I'm a functional, depressed individual in this space. But I truly believe healthcare is broken. I come from Canada. Now I live in the Bay Area. I've looked at multiple healthcare systems from England all the way to India. And I truly believe globally healthcare systems are broken, except for a few countries. Some of the numbers for the US, this is something that brings a lot of debate. More than 500,000 people die in the US as a result of medical errors. 2 physicians, this number is actually pre-pandemic. It's the most verified number, so I'm sticking with that. 2 physicians committing suicide each day in the US alone. 63% of physicians are in burnout today. You know, in some specialties like emergency, the numbers are much higher. 33% of nurses left healthcare in a sort of highly shortage of space we're in right now. That's challenging. This was last year. So my belief is that this is because our clinicians, our physicians are losing control. You look at ownership of practices, you look at any KPI, our physicians, the most important people in our healthcare systems are losing control. And you look at the works they do, how they work, how they dedicate life to their business, how they manage work-life conflicts. I think it's very, very clear that they're losing control. So my passion, my mission for the past few years has been empowering clinicians again, empowering physicians. And there are so many different things we could do. I love listening to talks from what HBEC is doing to some of the other startups. A lot of us are working in giving time back to physicians, giving power and control back to physicians, because that's going to create value. So the way we attack this problem is by looking at the mother of all problems, time. There's no value that you can put on people's time. And we think scheduling of clinicians is primarily done incorrectly, 100% incorrectly. What we believe in that space is that we need to add transparency, fairness, and equity by design, and we need to make sure everybody is aware. And that's what we call collaborative scheduling, which is a shift in paradigm. So in terms of MeshAI, where we started, the scheduling of clinicians takes so many different shades. We have more than 100 different scheduling processes that we have explored in the past 10 years. This project started academically. We currently focus on teaching hospitals, physician resident schedulings that are entangled. So when it comes to call schedules, those are the toughest mathematical problems actually humanity knows. And in fact, clearly in scheduling space, so we attacked those problems a few years back, and we have a solution that does a majority of those right now. Our number 1 competitor is really spreadsheets. Most people we talk to, even today, half of the demos we do in Canada and US, people are hoping to move away from a spreadsheet. And if they're advanced, moving away from maybe Google Sheets or Amion, which is another basic system. So we think this is a big problem today, but we're not even looking at the opportunity in the future. The healthcare future will be multimodal, from hospital at home to the traditional sense of healthcare that most people imagine. We need a melange of that, a mix of that actually empowers physicians, gives control to physicians in terms of where they want to work, how they want to work, where they feel less moral injury, and so on. So that's the future I see for healthcare, where clinicians are fully in control in terms of time as well as how they practice. So what is MeshAI? We built MeshAI essentially as a collection of 3 apps, iOS, Android, web app, easy facades that behind have a very complicated system or engine. What we're trying to do is collaborative scheduling, which is really a shift in paradigm. It's a new category. And we have also built a hospital at home functionality that is currently in beta with Medicare Advantage in one customer right now in the US. A MeshAI product has been in the market for 5 years now and is growing very rapidly. I'll give you some numbers. And that combination with a bunch of other functionalities that we built is going to be really the future that we would like to power. And I'll share a little bit more about that. Our model subscription, we sell monthly and annual. Most of our customers go annual, and even the ones that are to the right of technology adoption cycle, they come monthly. After 3-4 months, they go annual when they see the value of the system and the stability of the system. We spend about $2,000 to acquire an account, and LTV is $18,000. So our numbers are very, very healthy here. We've been nominated for innovation to reduce burnout. It's an honor. That's not what we started to work on, but we understood the connection between what we do and burnout and stress and wellness. And right now, we don't go after the hospitals. We've been selling to specialties. Now, CIOs, CMOs, CMIOs, and chiefs of staff are coming to us. Just 3 days ago, we were invited to speak with the CIO and a few other CXOs of the largest pediatric hospital in Canada, one of the best in the world. So that's, I think, really shows that we're on the right track. American Medical Women Association has picked us as the scheduler of choice because we help particularly minorities and women to participate in healthcare leadership position because we allow them to balance their time better and have more control. 2 of our competitors in Canada have come to us to use our engine, which is our secret sauce, in their back end to be able to do most complicated schedulings that currently they cannot do. We're in some of the best hospitals from coast to coast in Canada. 75% of our market is Canada, 25% of revenue is in the US. We have a small number of customers outside of North America, but we're growing very rapidly, and these are some of the best names. We've been in the news more than 100 times since the beginning of 2021 when we started actually capturing those from Cruz University in my lab where this began, all the way to national, international media. We've had 110% growth in the past 12 months. And our revenue is rapidly growing. And we've had 15 times growth in terms of demos we do in the past 12 months. We convert, this is a very tough space. We're talking healthcare, we're talking human life. People are slow to make decisions. Everybody knows in this space, everybody in this gathering. But we're very, very good in this space. We convert 74% in 6 months. In fact, 50% of demos we do convert in about a month. The market, very conservatively speaking, in the physician resident scheduling is $120 million in North America alone. And it's a $2.5 billion market, again, conservatively, and I'm not counting the future. We're doing the books of Amazon right now, but as you can imagine, the space of time for physicians and HCPs is much larger than that. So this is a very conservative number. Our differentiators compared to, like I said, our number one competitor is spreadsheets, which is column 1 here. PedalMD, QGenda are 2 other products that have some level of automation, but again, traditional automation. And Amion and other SaaS technologies are out there. Really, maybe 4 dozen products out there where every single one is doing it in traditional, I tell you when to come to work. Our approach is collaborative scheduling, and that has to do with how we do fairness and equity and how we show everybody who participates in healthcare why their schedule is fair. I think that's the key part of our product, in addition to the engine secret sauce. Our traction, more than 5,000 users, very rapidly growing right now. We do oral specialties, some better, some worse. Our number one specialties are pediatric and psychiatry, but now we're getting a lot of traction in anesthesiology and internal medicine, but we can do all of them. Usually it's us saying no because it doesn't make economical sense at this stage we're at. We're more power, more funding. We could do even more. Our ARR is surpassed $250,000, and our churn is 0 in 5 years. People who come to us do not leave. Thank you. I am a professor for 20 years, as I mentioned in the bio. This is my second company, and I almost lost my life to a medical error after a soccer game. And that had to do with fatigue, and the fatigue had to do with an error on a spreadsheet. That's how I started this company, and I'm not going to stop until we make a difference. My co-founder is a friend for 15 years, Dr. Ethan Hemming. He's a neuroscientist turned full stack developer. He leads technology. I lead the business, and we're about 16 people now. We're working on go-to-market in the US. US is a beast, is a 20x market, obviously. Having lived in Bay Area for 6 years, I've been gradually getting ready for this. We're ready to go there. We're raising $500,000 seed. ideally with Kiss and Save convertible, so that we can grow in sales and product work, so that now we can go, instead of selling to specialties, sell to hospitals and healthcare systems that are coming to us, asking us to participate in RFPs and such, and we're saying no. It's the time for us to do so. So we're clinician-obsessed collaborative scheduling, and we're hoping to really make a difference in clinician wellness and happiness in the future of healthcare. That's a QR code you can scan to check out the website and learn more. I'm more than happy to answer questions.
Awesome. Thanks so much. We've got a couple minutes for questions. So do our judges have any?
Hi, this is Sharad. Can you go back to your traction slide? Could you talk more about that? I don't know. You said you're raising 500,000. What's your current traction?
Traction, our ARR is 250,000 plus. I don't want to give an exact number, but we surpassed 250,000.
So with more than 5,000 users, what exactly is per average these sites are paying?
We have sold, because we've been experimenting with pricing in Canada, US differently. I can tell you on average, when we sell to a specialty program, it's about a $500 per month subscription, or about $6,000 a year subscription amount. And we don't charge per user our innovation is not just in technology. Our sale and business model is also innovative. Most of our competitors sell licenses per physician, per resident. We don't do that. Unlimited physicians is really good for locum resident dynamism. We charge based on the complexity of the scheduling that we run on our super mega engine. And so that average number is about $500 a month. So there are groups that are 10 residents, 10 physicians, very, very complex schedule who pay 500, and we have 150 residents of a program in family medicine that pay the same amount. So it's really hard to make that connection. It's really the complexity of the problem that we charge for.
Great. Any other questions?
Given this, and kind of wonderful to see all your progress along and kind of traction, when do you see that you're going to be kind of revenue positive from that and kind of your kind of funding rounds? I know you're doing seed, but are you planning Series A, or do you plan to be revenue positive by then?
Absolutely. So we haven't raised, by the way. This has been through FFF rounds, some money from friends and family and physicians. We have 16 physicians who invested through a holding company to get us off the ground, and personal money. And we are part of BRIA, an accelerator in Bay Area that Dr. Gary Goldman is here, who's been involved with. So we're a graduate of that. So we basically have done this with our own money in sort of bootstrap mode, and with very conservative projection. In 11 months, we're going to be cash positive.
Great. Thank you so much. If there are any